The question, what is the relationship between chronic fatigue syndrome and fibromyalgia? First of all, please note that most patients would prefer you call CFS Myalgic Encephalomyelitis, or me/CFS, because chronic fatigue syndrome makes it sound like an extra cup of coffee would cure it. Quite a lot of stigma is associated with it. I have had both FM and me/CFS for 15 to 20 years, so I feel moderately qualified to answer, but I may not be right up to date with the research. I certainly have no medical qualifications. No one knows the cause of either condition, although there are tons of theories. But me/CFS and FM seem to be caused by different things. FM is usually considered a form of arthritis, caused by autoimmunity. Me/CFS is probably going to be called neuroimmune one day, but right now only environmental health docs will treat it. It usually follows a virus that you never heal properly from, but, strangely enough, depending on what diagnostic criteria is used, many patients have both. I've heard it described as a continuum, where the patients with more pain are called FM, and more fatigue and exercise intolerance called me/CFS. That may be out of date now, but in my experience, in Canada, the only useful diagnosis is FM, since doctors and insurance companies and the guy on the street are all very dismissive of me/CFS. So I tend not to mention I have it except with other patients. And I receive no treatment for it. Note that in some other countries, such as Britain, the term fibromyalgia is not used, only me. And yet me/CFS can be fatal. And a doc who treats both me/CFS and AIDS said she'd rather have AIDS. Can you imagine anyone saying I'd rather have AIDS than an illness that no one believes is real, except the patients and a few doctors? That receives almost no research funding? That forced me to retire from work at age 35? Both illnesses are nasty. Both are exhausting. Both hurt. And you probably won't receive any casseroles, even though you'll probably be sick for the rest of your life, and many have problems doing basic things like cooking. Personally, I'd rather have cancer, because at least that would probably end by death or remission within a year or two. Okay, rant over. Check out the link below for a guide on long-term remission or to join in with the community.